Hey guys, welcome back to All in the Law. Today I'm gonna talk about quick pediatrics, and today's topic of discussion is when to introduce or food introduction in infants. Food introduction in infants. So this is really very important as if you become a physician or a pediatrician, most of the time you will come across with this question by the parents that this is the age of my child. Why should can I feed the this? Can I feed that? Blah blah blah. Okay, so the most important point that you should remember, you should never ever forget the best food for a baby, for an infant up to the 1 year of age or up to the 6 months, minimum of 6 months, is breast milk. Remember, there is no such what you call supplement or a formula, infant formula, that can beat what you call breast milk in its content, in its nature, in its what you call calories. Okay, so it's the best for that neonate. Okay, so let's talk about what things we can give. Before that, I would like to tell one important point about the cow's milk. Remember, the cow's milk, never ever start cow's milk in infants below 1 year of age. Never ever start this. Okay, and the cow's milk, if they feed the cow's milk, then chances of iron deficiency anemia is very high, because this the cow's milk contains very low iron and very low iron, and so the absorption of the iron doesn't take place much and results in anemia, iron deficiency anemia. Okay, so two important points about the cow's milk: never ever feed the infant that is below 1 years of age with cow's milk. Okay, right. And another point is it causes iron deficiency anemia. If you ask me about the goat's milk, remember, the goat's milk should not be given for a 1 year of age, because this goat's milk is associated with what you call a folic acid supplementation is needed for this. Folic acid supplementation is needed for this. Okay, so these are the basic things that you should never ever forget. So let's talk about the infant age is from birth to 2 months. As I said, the breast milk is very important, should be given, should be encouraged every 2 to 3 hours, or every time the baby cries you have to feed the breast milk. Remember, as soon as the baby starts sucking the breast and breast milk, and once it's full, once is satisfied, the baby will go into sleep. Okay, and again after 1 hour, 2 hour, or 3 hours, again start crying, then try to feed the breast milk as much as possible. Okay, if breast milk is not available due to some other conditions, some medical conditions, like if she's taking a drug or breast milk is contraindicated, then you can try with the infant formulas or a formula milk. Okay, the infant formulas are nothing but they are cow's milk based with modification. Remember, they are modified. The modification is really very important. Okay, right. Now let's talk about the 4 to 6 months of age. As the baby is growing, introduce iron fortified cereals. Iron fortified cereals. Okay, right. If the age of the patient is 6 to 7 months, what you have to do is strained vegetables and fruits. Strained vegetables and fruits. Remember, avoid the orange, what you call orange juice. Juices are never ever good for an infant below 1 year or below 6 months, because they don't give any energy, and during this period the energy is really very important. The calories are really very important for the growth of the important organs of the body, like a brain. Okay, that's why we avoid all those things. Unsweetened fruit juice can be given 6 to 8 months. Start with what you call a plain yogurt, cottage cheese, okay, egg yolk, but avoid egg whites. Remember, avoid, you should avoid the egg whites. Avoid egg whites, really very important. Avoid egg whites. Okay, start strained meats, poultry, beans, lentils. Okay, lentils puree maybe also be given at this age. Okay, but what you have to do is stepwise addition of the food is really very important. One food every 3 to 4 days, because if there is a diarrhea with that, if there's undigested food is coming from that, then you will come to know. Because if you give all the fruits, all the what you call vegetables, or everything is new, and everything like cereals, juices, meat, everything is mixed, and you give to the patients and to the baby, and the baby develops a diarrhea or indigestion, then it will be very difficult for you to find out the cause, whether it's due to the meat, whether it's due to the beans, whether it is due to the vegetables, yogurt. Okay, so better you should give one food every 3 to 4 days. Now if the age of the patient is 7 to 9 months, is growing older, okay, you can start with the soft meat, poultry, mashed fruits and vegetables, cheese, and the cereals can be given. Fruits, vegetables, okay, cheese, and cereals. Okay, if 8 to 10 months, you can start with the soft finger foods, meats, poultry, cooked vegetables in strips and slices. From age to 9 to 12 months, regular table foods like meats, poultry, cooked vegetables in strips and the slices. Okay, regular table foods. 12 months onwards, now you can give whole egg, okay, orange juice, cow's milk can be given, right? Because cow's milk has a high protein content. Now the protein is really very important. It has high what you call medium chain fatty acids. Okay, very important. So these are the things that you should start now after 12 months. Okay guys, so thank you so much for watching this video. Take care.